You're gonna have to tell Scott to live a little closer to
I
Atlanta.
know.
He'd have a hard time getting.
Yep.
Yeah.
All right, so hope everybody's doing well today. Appreciate all your work and all you do every day. And I'm just ready for it to get hot again. You know, I thought it's about to get hot and it got cold again, but anyway. But Emma's wearing the springtime outfit there, so I'm trying to bring it on. So that's good. All right, so we'll go on and get started. You want to do a attendance report?
So in the room, we have Scott Johnson, Monica Walters, and then online, we have Doug Aldridge, from Hamilton, and West Lewis. So we do have a quorum of this.
Wonderful. All right, this time, I guess we'll get started on the program reports. I should say who, right? Okay, sorry. All right, John? Lawrence. All right, Ron. You wrote it out. I didn't even pick it up. So. Thank you, sir. All right.
Nice to be with you. Thank you for spending time with us this afternoon. We have some prepared comments I'd like to share with you, then we can take any questions or any feedback that you have. So again, nice to be with you. Again, my name is Lon Roberts, L-O-N Roberts, Deputy Commissioner of Child Welfare. And again, pleased to be here with you today. I'm going to share some observances, events, and initiatives that are taking place within child welfare. Start with highlighting some data that the team here, the board requested. So you'll see the first data slide is the number of children and youth in foster care by state fiscal year. The number in teal represents the children under the age of 18 who are in care. The top, the blue represents youth 18 to 21 who've chosen to remain in care. So it's been fairly consistent. The next graph is the number of public and private foster parents in Georgia by state fiscal year. Now that looks from a distance looks more shocking. The scale of that makes it look a little more radical than it really is. So I beg your indulgence on that.
Well, we're going to talk more about that later.
We can, yes, sir.
Okay.
And the next graph highlights the average time our children spend in care by state fiscal year. Over the past 5 years, the average number has remained between 24 and 25 months. So again, the scale looks a little off there, but it's been fairly consistent over the last 5 years. Now we'll talk about some events that have taken place. Start with the AFPAG conference. I'd like to highlight the Adoptive and Foster Parent Association of Georgia, also known as AFPAG. AFPAG collaborates with public and private child welfare agencies to help improve foster care and adoption processes, support foster adoptive families, and provide educational training for families. Each year, AFPAG hosts an annual educational conference. This conference this year was held in February in Jekyll Island. There were 409 foster and adoptive parents across the state in attendance, so a good turnout. This year, DFACS awarded 140 conference scholarships to our foster and adoptive parents. These parents were selected for their continued commitment to Georgia's children and youth in care. While at the conference, our caregivers and staff participated in sessions and workshops that provided valuable opportunities in education and support. Always a good time down there. AFPAG Case Manager of the Year. AFPAG selects a Case Manager of the Year to be recognized during the annual conference. Michelle Stinson, a DFACS Social Services Specialist in Region 9, received the Case Manager of the Year award for 2025. Michelle Stinson has been with the division for over 20 years, and her hard work and dedication to serving Georgia's most vulnerable is truly admirable. We're incredibly proud of Michelle for this honor. So congratulations to Michelle Stinson. Next, we'll talk about Teens Are For Me. Last month, we held the annual Teens Are For Me conference. The Teens For Me conference is designed to strengthen engagement with youth in care between ages of 11 to 17. We had 68 child welfare professionals participate in the Teens For Me Adult Day. Throughout this portion of the conference, child welfare employees attended workshops on serving youth with complex needs, youth engagement practices, transition planning for teens and youth, and ways to avoid burnout. There were 95 youth who participated in the Teens for Me conference. These youth participated in workshops on a variety of topics, including cooking, budgeting, and conflict resolution, all very important. 25 vendors were present to provide valuable information on post-secondary education and employment opportunities. The Georgia Department of Driver Services was also present and able to provide 15 youth with state IDs on site. As a fun way to end the conference, our youth were able to attend an Atlanta Hawks basketball game. This year's conference was a great success, and I'm thankful to the over 30 staff and volunteers who dedicated their time to plan and attend the Teens for Me conference.
When was that? Was it part of this one or a different one?
It was in February. Yes, sir.
February.
Yes, sir. Let's talk about social work month. Throughout March, DHS celebrated Social Work Month. We use this time to recognize the outstanding social workers who are dedicated to assisting Georgia's children and families. In February, we asked the district, regional, and county directors to nominate social workers from their teams who exemplified compassion and service. We received countless stories of social workers from across the state who have gone above and beyond to serve our families. We are able to interview these nominees. I'd like to share with you some photos and the responses that they provided. I won't read them to you. I might pull out a few excerpts, but we have Garrett Pierce. I discovered a passion for matching children with foster parents who can meet their needs and provide a nurturing environment to help them heal while their biological parents work on healing and completing their case plans. I thought that sums up our work very effectively. It's a good job to Mr. Pierce there. We have Shayna Francois. Again, just a highlight of her statement. My goal is to create a safe, non-judgment space for all my families to express themselves, which allows for open and honest communication. And that's the core of good customer service is communication. So I think she nailed it there. It's a good job, Ms. Francois. Chelsea Hasty, with donations, she gave a good example. With donations from community, I was able to help this mother fully furnish her apartment, including items the children needed. Ultimately, the children were unified successfully with their mother. Another good success story and a good example of working collaboratively between the department and the community. And then finally, we have Ms. Scott, Stephanie Scott, in the excerpt of her quote, I love empowering them, talking about teenagers, to continue learning on a college pathway by attending their IOP meetings and purchasing their college t-shirt for them when they receive their acceptance letter. So I think those quotes really summarize a lot of good work across the spectrum of child welfare. I'd like to talk a little bit about Child Abuse Prevention Month. April, it's current month. April is Child Abuse Prevention Month, a time to raise public awareness of child abuse prevention efforts, encourage community involvement, and promote resources that strengthen families and ensure every child has a chance to thrive. In March, DHS leadership and staff representatives from Positive Childhood Alliance Georgia joined Governor Brian P. Kemp and First Lady Marty Kemp at the state capitol for a photo opportunity, you can see on the slide there, with this year's Child Abuse Prevention Month proclamation. I'll talk about National Foster Care Awareness Month, which is coming up in May. Our division will join the nation in recognizing National Foster Care Awareness Month, a time to celebrate our current foster caregivers and their dedication by providing stable, loving homes for children and youth in foster care. We also use this time to raise awareness about the urgent need for additional foster caregivers across the state. We'll be hosting events throughout May to celebrate our current caregivers and recruit additional caregivers. I encourage you to monitor your email as we extend invites to you to join us in these celebrations. So more to come. I'm excited for the opportunities we have planned. I look forward to sharing more updates on the National Foster Care Month in future meetings. Now we'll talk more about independent living again. We're going to talk about housing choice voucher program. The last item I want to highlight today. Our department has continued to prioritize the housing needs of young adults as they transition from foster care to independence. The Housing Choice Voucher, HCV, program has been critical in meeting the need. Housing Choice Vouchers are funded by the U.S. Department of Housing and Urban Development, HUD, and are administered by the public housing agencies in the form of a foster youth to independence or family unification program vouchers. Our foster youth to independence vouchers provide housing for youth in foster care from the ages of 18 and 24. Our family unification program provides housing assistance for youth in foster care between the ages of 18 and 24 and families in the process of reunification. We currently have 6 partnerships with housing authorities across Georgia, including Atlanta Housing Authority, Brunswick Housing Authority, City of Carrollton Housing Authority, Housing Authority of DeKalb County, Housing Authority of Noonan, and the Housing Authority of Savannah. A lot of good big players there. We also partner directly with the Department of Community Affairs. Each public housing agency is only awarded 25 vouchers per fiscal year. It's DHS's responsibility to prioritize youth based on need and appropriateness of the referral. As of January this year, our well-being section has assisted in securing 33 vouchers for youth. So they're doing a great job. This is an incredible accomplishment, and I'm eager to see this number increase as the year continues. We have dedicated staff working on this effort, and they are continuing to reach out to additional public housing authorities across Georgia to develop additional relationships to maximize this opportunity. I'd like to recognize Don J. Calhoun as a big player in this work. So good job, Don J. Talk briefly about Celebration of Excellence. Each year, DFACS hosts the Celebration of Excellence, an event honoring the secondary and post-secondary achievements of our youth and young adults in foster care graduating. This year's Celebration of Excellence will be held on Thursday, July the 10th. I encourage you all to save the date. Again, we'll be sending a formal invitation and information on registration at a later date. But I want to personally invite you to join us with this event. So with that, a lot of good things going on in child welfare. We appreciate your support, and any questions or any comments or any topics you'd like us to talk about in the future. Love to hear.
Lon, what is the venue for the Celebration of Excellence this year?
The Celebration of Excellence. We got the hotel. Actually, it's a hotel environment, right? But I forgot to look. I'll get that for you.
Okay, that's fine.
Sure. Sorry about that.
And also the Housing Choice Voucher Program. I didn't hear you mention Macon. Is there one in Macon? Because that's a
Critical one.
critical-
Yes,
yeah.
ma'am. Right. I don't think currently, but we're all working to reach out to all the housing authorities to try to partner with them. So I'll make
Okay.
a note about that. Make sure we're targeting Macon. So you're right.
Okay,
Macon's a
good.
key player in the state. Exactly.
I want to ask you about Augusta.
Yes,
I
sir.
understand we've got we're building some tiny homes for a bridge in the area. It's going to have, I think, 10 or 12 tiny homes. And they just kept poking around on it. Now, are we part of that or not? I'm just trying to.
I don't think part of this voucher program they're not, but again, it's a work in progress trying to bring other housing authorities in. So we'll make sure we reach out to Augusta and to Macon to make sure that we're
Because I
looking
know
for
we have 19 authorities or locations in Augusta.
right.
This is something totally separate that they're building.
Yeah, we'll reach out to them. Sure.
Please.
Thank you, sir.
And now when we'll go back to something you said about they're in 24 months.
Yes, sir. Kids in care.
Yeah, the first you just talked about in the service. Average time, 24 to 25 months, average time spent in the care.
Yes, sir.
Is that all the we got 10,000? Am I reading that correct? In 25, we got 10,392.
Yes, sir.
And we got 667 between 18 and 21.
Yes, sir.
And go back to you said up to what, up to age 24?
Ages 18 to 21 are the
Well, over on the backside, says youth and independence is 18 to 24.
right.
Their
They're
family unification program is 18 to 24. Help me describe the difference there.
I think the program, we could help someone who's in our care aging out and get them set up to community sports to go further and through the extended youth support services. So the cutoff for us would be 21, but working with you, we're trying to get you set up where you can go further with other support. So this program is separate from just being for our foster children. It's for foster youth independence vouchers. So it's trying to stage them out. So not just the 21 are out the door, right? But I'll get more information. This is sort of new. It kind of came on quick. I'll get more information for this for us as well.
And,
That's a great, I see your point. Good question.
and if that's the case, is that something they apply for through us, or is it a federal project, or?
It's something we recognize. We're working with our state office, Don Jay's team, the well-being team works to coordinate these. It's the funding is federal. We work through the housing authorities to get the voucher.
Wow.
Yes, sir.
Okay.
And so I mean, we have done 33, so that's good, but it's not, I mean, it's still early, right? So not earth shattering. So we're trying to continue to develop it out. And so I'll make a note. We'll bring this back and try to keep this highlighted. It's a really exciting opportunity.
The question I have on that is this like apartment complex, or is this state housing, or what are the living arrangements?
My understanding it can be apartment, other kind of communities, not just into a community government housing, but also can be in the public, housing.
And the state pays with the apartment complex or whatever.
Right, yes, sir.
For the voucher.
Right, community, yes, sir.
And is there any, so they just live alone? I mean, if they are, 19, 20, not dealing with the 24 thing, but is that, so the state basically pays for their living?
Right, they pay for their housing, but they're also, they go to school. A lot of times because they're going to school, they work in jobs, right? It's just like young adulthood, and we're trying that, they'll continue to have a
And
caseworker.
how do they check in with a caseworker?
Right, yeah, be caseworker, have to have caseworker,
Okay.
yes, sir.
All right, cool.
Yes, I'm just pushing them out there, yes, sir.
Follow up.
At some point it may have been, but now, I mean, we see that,
In other
right?
words, they're not on their own. We have case managers that monitor them daily or weekly, or is it?
It's kind of as needed. I mean, it could probably at least monthly, but it could be if you have a child who's really struggling, you might check in more often. I know there's some independent youth who reach out and text me occasionally and just give updates what they're doing. And hey, I'm trying to reach so and so. So I think it's a network of support, but and a lot of it also you have some private providers to support the program. But a case manager will be working with them to make sure they have their educational, they're in school, getting school grants, helping them find jobs, and make sure their medical needs are met. So they're not on their own. So if they're having trouble, they're sick, they reach out, we'll get them to the doctor, whatnot. So.
Well, I guess I'm sort of going back 1900s when I went to school and college. We used to have a house mother.
Right.
And we had somebody check our dorms, and they checked it, make sure
Right.
that we had our windows down, our beds were made, and all that kind of stuff, are we? I'm just kind of curious if it's more like dormitory style, like when we were first off at college. They didn't just let her run around on the
Sound
campus.
like it to me.
No, that's really in that community. It's in the community, and it's could be rent assistance, that type of thing. I mean, I like what you're saying, but this is going to be in the community placement, and you're going to have case manager and other services wrapped around to make sure they're safe.
I'm also concerned about where they're placed. If where I'm headed with this, their placement, location in the city, is it
High crime, low
high
crime.
crime, low crime? Is it suburbs? What? I mean, this type of thing, because we're not going to accomplish our goal if we throw them
Right. No,
in
you're
the
right.
wrong neighborhood. That's
Right.
all I'm saying.
Yes, sir. And I'm getting more on that. I mean, I don't think we're doing that, but I don't want to speculate anything at all. I mean, I know we're going out and making sure that they're housing, we're seeing them, make sure they're a doctor, getting them in school. We're really trying to add that additional layer of support. At the same token, recognizing that they're trying to develop independence to be adults and move forward as well. And so we're trying to help them. I know there's a lot of community partners, Faith Bridge, a lot of other partners who work with us, really effective partners to help. So it takes all of us to do it, but I'll certainly get more information for it. I think it's
It probably just comes down to the caseworkers' determination rates. Is this an okay place?
right. Yes, right. Right. Yeah.
Okay.
Yes, sir.
You mentioned, Ron, somewhere in the 30s right now, the number
The
of.
voucher, yes, sir. Right. I think about
When we
33.
hit full stride, what do you anticipate the number of people that will utilize this particular program?
That's a great question. I'll have to talk to the team about that. That's a great question. I mean, in theory, you'd think if we have 600 children in care, all 600 would be, but
Right.
all, maybe they don't need it. So that's a good question. I'll ask what we think that target would be. My instinct would think would be at the 600 range, but it may not be. So
I think it's a function of budget, isn't it?
right. It would be right. What's
So-
depending on what's available. Right. Exactly.
Well, yeah, I understand it's a function of budget, but maybe I'm a little different here. I think the priorities are what inform the budget and not necessarily the other way around. We need the money. That's where we can help.
Right.
We can go to the legislature on your behalf or to the governor if we think this is an important program. And we think we can do some really good here. And so I was looking at the same sort of thing. How much of that number, 600, 800, whatever it may be, might want to use this particular program? And if it's something we're committed to, is it something we're pushing as a viable alternative with the 16, 17, 18-year-olds, informing them of this particular program? And then what kind of resource commitment is that going to require among your caseworkers and things like that?
Right.
So it's a scale issue.
Right, exactly. It is very much so. And it's still in its infancy, but we'll vet that out and come back with some more projection for you on that one. It's great. I mean, you think about how scary it would be in 19, 20, 21 on your own with no parental support, cut off. I mean, all of us who come in college had mom or dad helping grandma, someone. So it's a really
drill instructor.
Yeah.
right. But you at least have someone care about you and take care. So I think this I'm glad in child welfare we're really looking at our older youth to make sure we're not just, hey, see you, good luck. We're actually supporting them and helping them transition. And my experience with it, even on some direct case stuff, has been really good. So I'm excited we're looking at it. I think it's still in its infancy, like I said, in some ways, but we'll continue to talk to the board about it, bring updates on it, and to continue to go around to the boards and the housing authorities and try to make sure we're making those connections and getting it across the state.
Let me know if you're in Augusta. I want to know if you're going to the housing authority. When y'all we can make contact and we have a meeting, I'd like to participate in that.
Yes, sir.
Okay.
Sure will.
Before you go,
Yes, sir.
I know foster parents, we've talked about foster parents a good bit, and I mean, we're losing a lot of folks, 14% from 2020 to 2024. And the number of children is pretty much stable from 11,000, 10,006 to 10,392. So what are the plans? I know we're going to have that event later this year, but we have it every year, right?
Right.
So
right.
if we're continuing to lose 14% of the foster parents, I mean, there wasn't much loss from last year to this year, from 23, 24, but it was, dramatic on some years. So my question is, why is that? What are the reasons behind it? And then secondly, how are we fixing that issue? Because we got to have foster parents.
We do.
And the subcommittee on the children's side is asked about to get some additional data. Y'all brought us some additional data, but really what's under the data is really what I'm interested in.
We're looking for the why.
Why, right.
The why, like, input that we get from
Right.
many foster parents is, all the hoops you got to jump through, especially even if you've been a foster parent before and you stop being, maybe you did adoption or whatever, and now you got to go all the way back through this thing. And so what are the things that are making us lose 14% of our foster parents from 2020 to 2025 or 2024?
Right. And unfortunately, I don't have the magic answer. I do know that the challenge, I think, on foster parents is greater than it was. I think we have more children with higher behavioral health needs. You have a more challenging environment for foster parents. So I don't think foster parenting is maybe what it was in the past in terms of what you're doing. So it's a harder challenge. I think that's part of it. So we need to do similar to what we've done with recruiting staff. We recruit staff. We have to be realistic about it. We can't act like this is, an easy, cushy job when it's not. It's a very intense job, or labor intensive job.
Mm-hmm.
And I think we have to do the same thing with foster parenting. So at the core, of course, the answer is always recruitment, trying to find foster parents. I think being honest with foster parents. You have the challenge, as you do with a good staff, is if you have a really good staff worker, sometimes you burn them out because you lean on them too much and they keep saying yes. Sometimes foster parents can do the same thing. You lean on them, they're yes. Next thing you know, you've overwhelmed them, you've taxed them. So I think we have to recruit, we have to level set and be honest and totally transparent with foster parents of what the job entails. And I think we have to be really, really honest about the need is different. It's the need, again, we have behavioral health needs, we have a lot of older teens coming into care now. And it's a different challenge than and it's not as appealing to some people. And some people it is, but some people it's not what they're looking for. So I think the transparency about it, I think we'd be real careful about just being truthful about it, not trying to.
I appreciate all those comments, but that's not really doing anything specifically to fix the problem.
Well, and
Right,
my
no, I mean,
question is still, are we even asking the question when someone leaves foster care, when a family closes their home? Do we keep track of the data of why that home was closed?
That was what I was going to suggest. I'd like an exit report
Yeah,
of why they stopped being
Right.
a foster parent. Is it, okay, well, I just adopted 2 children. I totally get that. That's
Yeah,
right.
right.
But I don't think we know why they stopped being, besides it's hard work, things change, all that.
Right. No, you're right. And we do see, and there are, I mean, and again, it goes back to being transparent. And when we're talking to foster parents, you do have foster parents who serve very well. They adopt, they get their family set and they move on. And you do see that.
I get that.
And we track that. And I get that as well.
Do we track that? Do you have those numbers?
Not in front of me, no, but I can get that for
I'd
you.
love to
Okay,
see that.
great. Yeah.
And then on average, how long do the foster parents foster? On average, we get 4 or 5 years out of them, or do we get 2 years out of them? And then I would like to see a list of why they stopped being a foster parent statistically, so that we can determine what is the biggest problem.
Right. No, that's
I
all.
mean, if you have a restaurant and your sales are going down, your transactions are going down, you're going to ask, hey, what's wrong?
Right.
And either it's not clean, or food's not good, or it's a scary place to be, or whatever.
Right.
So-
So you're 100% right, Chairman. And just like with hiring staff, sometimes when you're losing, you're reactive, trying to react to the problem, being proactive. I think you're right. And we do some of that when you recruit and try to recruit more aggressively and more targeted wise. But I'll get the data for it. And we make the next conversation much more targeted.
Well,
with that.
and again, not just the stats. I'd like to know what the stats are, and then what that's telling you,
Right.
and what are you doing about it?
Also, I think would be helpful too, in dividing up this 10,392 by age. I mean, telling me 0 to 17 is not telling me a lot.
Oh, yeah,
And
exactly.
I don't know how many how many of them are over 7 or 6 years old, or, that type of thing. The older ones are going to be more difficult. I understand. So we maybe need to look at adjusting the system somewhere or another, because infants to 6 is a little easier to place than you have a 7 to 17-year-old child.
Right. Yes, sir. Yeah, and I can get that for you very easily, the breakdown by age. Yes, sir.
Please.
I want to comparatively too.
So, and if you can, either you or Mary, whoever wants to, you can just communicate with me directly on that.
Oh, yeah.
And you can give me something in the next 30 days.
Yes, sir.
I certainly don't want to wait another, 3 or 4 months before we know
No,
what's
glad
going
to do
on.
it. Glad to do it, sir.
And then, when was the foster parent focus? Was that already happened, or is it getting ready to happen, right?
Right. So, keep myself now. Foster parent month is coming up in May, right?
Right.
Yep.
Right.
Which
That's
says,
in May. Yes, sir. So we'll be, we'll have some events. We're trying to include them, take invitations out to this board, and appreciate your support on that always.
Please.
right, but you don't have a date specifically that.
Not yet. No, sir. I don't have it
Okay.
yet, but we'll
You
soon
can
as we get it, we'll get it to you, sir.
Okay.
Yeah.
All right, as soon as, if you can get that through me the next week, that'd be great. So that we can, it's April, pretty close.
It's
you
coming
know?
up, right? Yes, sir.
Yeah.
Right.
All right, thank you so much.
Thank you very much. I appreciate it.
it.
Appreciate
Yes,
your
sir.
passion on the topic. Really do.
Yes, sir.
Thank you so much, y'all.
All right, you bet. All right, so next is Officer of Family Independence, John. Thank you. No more tornadoes, right?
No, not, we actually did have some tornadoes early this week.
Yeah.
They touched down, but no damage to, the one was kind of close to one of our offices.
It hit you one offices?
No, close by. Effects off, I think in Early County, maybe on Monday, but we, no DSNAP events.
Good.
In following that, so that's good to know about. So if y'all can continue to help join me in prayer for Georgia to keep us out of another DSNAP event. going to report on some different topics this time. So on the next slide, you'll see kind of a table of contents of things I'm going to go over. Feel free to jump in at any time, though. You know, I'd rather this be a conversation than a presentation, so I'm happy to answer questions throughout. I'm going to hit 4 things today, but really kind of, you know, I like to hit the big themes with y'all. So, you know, some of the technology enhancements we're making to improve the system to make it easier for folks to navigate. Some things that I hope will improve customer service, and then one last thing about retention. I'm thinking about this presentation is hitting those big three areas. The first one is an enhancement to our what we call the provider portal. And not to get too much in the weeds, but Gateway is the system that most of our clients interact with us through. There's 3 ways to get into the Gateway system. There's the public facing one that y'all are probably familiar with, the customer portal. We have a lot of community partners that help us out. They do applications for folks, and they use the partner portal. But the provider portal is the 3rd view into the system, and that's how providers that, you know, nursing homes, waiver service providers, hospice providers can actually go into Gateway and make changes on behalf of their clients. In a lot of the cases, they're the authorized representative. In some cases, they're just helping the clients, you know, remember to do their renewal, or assisting them with gathering needed verification in some instances to complete that process. And so we went through the Medicaid redetermination process. As y'all may remember, we did some presentations about that. And one thing that we found out during that process, or came to my attention, is that the provider portal wasn't, you know, maybe serving the function that it should. So it was really designed so that providers could see into the system and help get their clients renewed. You know, we don't want anybody who's eligible to fall off the program, because they'll just come back, you know, and keep applying. We have to touch them multiple times. So we did a big enhancement to the provider portal. And I'll show you a picture. You know, I always debate whether or not to include the pictures or not. It's hard to really see, but y'all have a quick picture of it. But really, it was to allow them better view. Like previously, they had to look up their clients one at a time using a search functionality. But what we've created is a dashboard for them that will show them all the clients that are linked to their facility. They can see when they're up for renewal. They can track any additional information is needed to be provided by them. You can kind of see it here. You know, it's tiny, but you know, those little bubbles, those little boxes are all search boxes. So they could start typing John, and it would show everybody named John that's in their facility if they wanted to. If they have the client ID, they can use that. But really, it allows them to pull people up very quickly. And then another challenge thing that we've improved is if they do need to take action, there's links right there. On the far right-hand side, again, it's tiny, so sorry, you can't really see it that well, but there's an actions column. So if they want to initiate a renewal, if they want to upload a document, they can really easily from this one page pull up, see all their clients, and take action if action is needed very quickly. So that there's a lot more to it than that, and I kind of went through some. I listed out the bullet points, all the new things they can do. They can export it to Excel. You know, a lot of things that make it a lot easier for them to use the system. And so while this is, you know, it sounds like it's something for them, it's also selfishly for me too, or us at OFI. You know, if they can better see into see this information, it makes the process move a little more smoothly. They don't have to call me to find out what they need to do to renew John Holman's case. They can go pull up the dashboard and be like, oh, I need to submit this thing. Because that's a lot of it's kind of a back and forth communication piece with some of the folks in those facilities is like, hey, I submitted this and I, you know, haven't heard anything, and they can come in here and they can really see, you know, the status of where things are. So this has been, you know, really well received by the provider community. We used Georgia Healthcare Association to push out, you know, some messaging around it. We have monthly calls. On the next slide, you'll see some of the feedback we've gotten. You know, over 140 new providers have requested access, which is great. You know, that's showing that the word's out there and people are, you know, they talk to each other. So talking about how this is now a very usable resource. We've had existing providers request to add new users to their account. So that's really great. You know, there's a lot of turnover during the Medicaid, the pandemic time period. And so trying to get those new folks in those new roles, you know, to understand the process and access the technology and track their folks. It's been really positive. We have those monthly calls I mentioned just now, using that as an opportunity to promote the tool and train people on how to use it as well. So people have been pretty excited about this, and I really, you know, hope to continue engage with that provider community to raise awareness about this tool so that we can manage that part of our population. It's really, a lot of them don't have a lot of changes in their lives, so we'd like to reduce churn in that area as much as possible to, prevent. We have enough work, just doing the annual renewals and things like that. No need to create additional work. So very excited about that winning in January. And it's been pretty positive. We usually I can kind of gauge where things are going, especially during legislative session. A lot of people have access to more people than they do in other parts of the year. And, the nursing home community, I think this did a lot to improve our relationship with that group. So happy about that. I'm going to switch topics for my next thing. Georgia Gateway kiosk. So we currently in all of our county lobbies we have kiosks. The older version was kind of a big thing that was intended for scanning documents. So clients would come in and have a bunch of stuff they wanted to submit to us, and not necessarily leave it with us, but they could use a scanner to add things to their case. I'm in the process of replacing those. So one of the projects I think I presented to y'all was working with the libraries to put out some kiosks in the libraries. We're copying that project now in our own office. So it's very successful. We made some tweaks. The stands we're using are a slightly heavier model, and we're using iPads as the tablets instead of the Chromebooks. But currently trying to remove all of the older kiosks and put in these new ones.
What do you do with
the old ones? There's not really.
Junkyard?
Yeah. There's a vendor that maintains that for us. So that vendor we're working with them to pick them up and dispose of them.
How long did the other ones last?
I don't know off the top of my head. I want to say a long time. But
Got our money's worth then.
people, the use of them kind of declined a lot though. That was one of the things I looked at before replacing them. You couldn't go in and apply or renew your benefits on those kiosks. It was
Okay.
really just, you could pull up your case, click on it, and then upload documents. But these
Okay.
new ones can do it all.
More multi.
Yeah, they have cameras on them like an iPad does in the
Right.
back, so you can actually take pictures of your documents if
And
you
you
have
read it.
them. And it'll upload it directly into their account right there. You can do the whole application process and stuff like that. So I think I hope this will be a big improvement to, those previously used kiosks. And we had computer banks a long time ago in our offices. And kind of got rid of those during the PHE time period. They were getting a little older. And we weren't, we don't want people hanging out during that time period in the office either. So I'm hoping this is kind of a hybrid between those two things.
Is the purpose of these so that they don't have to talk to a real person?
No, well, a lot of people come into our offices because to get an application, like a paper application, and wherever I can avoid that, I want to, because processing a paper application takes twice as long because someone has to go and then type everything that was written. And it's a lot of pages. And so if they can do it electronically, no one can do a typo. It's right into the system and another person doesn't have to touch it. So really it's
More
combating some of
cost
that.
effective.
Yeah.
It's much more cost effective, much more accurate. So hopefully that is one of the many benefits we can see from this. But really, the folks that ask for an application will be like, hey, we can give you a paper one, or you can just step over here and do it on this.
It's
kiosk.
faster process and all that.
It is. So we try to encourage people
But
that
it's
way.
iPads, right? It's like
They
an
are
iPad.
iPads,
And so
yeah.
they're basically typing in like how you would your iPad.
Correct. What's interesting, it's not shown in this picture, but we did a pilot with just a couple counties. And the first thing that somebody did was grab it and turn it this way, like their phone, because that's
Sure.
how that orientation is
Sure.
what people are used to. So we may reorient them all in that direction. But it was just an interesting thing that we did. But so far, I think I have some numbers on the next slide. Talking about, I think we've got, we're planning to do 2 in every county. Some county offices, size-wise, could only accommodate 1. That's a small number. But we're trying to do 2 of these slim kiosks in every office where we can. And the bigger counties, we're going to do more. I think I ordered about 400. And, if you divide that by 150,
59.
yeah, 159, excuse me. Yeah, we should be able to get at least 2. And, if I have some funding available towards the end of this year, I plan to buy some more to kind of push those out. But right now, I have it listed by district. I don't know if you have the district map memorized in your mind, but I don't either. Honestly, I have a cheat sheet pulled up in front of me. So, District 1 is kind of our northwest region. District 2 is northeast. For some reason, 3 is Savannah and into the city. So it's like not really the order of the numbers is hard to follow. But, we started up north and they're kind of, it hasn't really been like we're doing it from the north to the south. It's the vendor mailed them all out and we're standing them up as fast as we can. We have, we call them the BASS team that's within OIT's group, and they're kind of putting them together and connecting the internet and stuff. It's pretty easy. So some of the counties are doing it themselves. You just take it out of the box and put it together. It's like a 10-piece puzzle. I built one of them myself. It does take.
Is it hard plastic? Is that what it is? It's got a metal.
It's metal. Yeah,
it's metal.
the stand is metal.
Okay.
And one of the other things that was great about switching to iPads is everything's made to fit an iPad now, and so they fit really well.
Yep.
That was a challenge we had in the library kiosk version, but they wanted that Google Chromebook environment for their IT purposes. But these are getting mailed out. We've had a couple when they get mailed got damaged in the mail, but no other issues with ours. It kind of stuff.
Do you put them at different heights so they're accessible?
So the little neck of it can bend down, but we're there. When in my previous position, I actually worked on the library version of this, and it's there's not a lot of options out there. But we did pick the one that had we call it a gooseneck that can kind of tilt up and down to help for folks who are maybe in a wheelchair or something like that. Reach it. There's a little bit of that in there.
I'm just kind of curious. We got 2 districts of 0, we got 4 and 7. Where are they? You have any idea?
So 7 is Metro Atlanta.
Okay.
Just DeKalb and Fulton counties. There's that district, and I think they have been mailed there, but just not set up yet because the BASS team's working on the other locations, and it wasn't intentional. I think it's maybe just delivery dates and coordinating that piece. And then District 4 is Western Georgia. So that kind of goes from like Carroll County.
You like talking about Columbus?
Yeah.
Okay.
Yeah, in that direction. So I think it goes from Carroll County down to Clay County and then 3 counties over to the right. I can follow up with you about why they haven't had any started yet, but I assume it's delivery timelines and then the availability of the IT folks to go, because they do have to go to 150 places to set these up. We've got maybe, I don't know if I have somebody, Russ here, who can tell me how many people are on the BASS team. Maybe not. But do you know how many people we have on the BASS team? Roughly 34. So we do have a small little workforce. That's not their only job though, building these kiosks. So they're trying to do it as it makes sense. They have to come in to help folks with their hardware and trying to coordinate schedules and stuff like that to get them stood up. But we anticipate having this done by the end of June. So to line up with the state fiscal year. So pilot ended last month in March, and we started deploying statewide. So I think that was
All right, with this, what's the numbers you're looking at? Were you looking at, the old ad was we'd go in, we were the old days back in the 1900s, we worked with paper, then we go to computer and we handle more, but it didn't solve the paper problem. So my question now is, we do this, are we going to be servicing more, or is it going to tighten down? Is it cut on our end, or is it we're going to be allowed to give more service to the recipients?
That's a good question. So I think, ultimately I'd like to reduce that number of paper ones that we're processing. That's my goal, is to make it, give them another option to apply online for people who don't have internet access, don't have access to a computer or something like that. And folks that come in and request a paper application, there will always be people like that, I think. There are some folks in our community partner group too that I try to work with them too, to encourage them to send people to the online process, just because of the work that it takes and the potential for errors that can happen when you're doing a transcription from paper to electronic stuff. So I think that will always exist, but my goal is to reduce that number as much as possible. And, I do think that it will give people an opportunity to apply quicker and get in the system faster. But I think those people were going to come in regardless, it's just making it easier for them.
How about, possible duplications or, going into different regions or whatnot, or even come from a different state? Are we gonna be able to track that, or can we track it?
Yeah, we do. So one of the things that every application that comes in before it's processed by a worker goes through our registration team.
Mhm.
And so like say John Holman comes in and applies 4 times in a row,
Right,
we link all those together. So there's a system process that tries to do it automatically. Like if you provide your social security number, it makes it very easy to kind of bundle them all together. But sometimes you don't, and a person actually has to look at them when it's a fuzzy match, is what we call it. And so those are combined. So if someone were to do that, we actually get a lot of that. I actually talk about that in my next slide.
okay.
We recently just did a change to the system actually to make it easier to process stuff, because that was a big challenge for us too. Because when we get an application, say I apply 4 times, the caseworker has to look at every single one of those.
Mhm.
And a lot of the times, which is, I honestly don't understand this, but the information isn't the same all the time.
Yeah.
You know, sometimes they may provide less information the first time and more information the second time or something like that. So we have to look at them all and make sure we're including all of the information that was submitted on all the applications. So we actually I thought about presenting on this, but that might be too much in the weeds, but we just did we call it duplicate application change release that was to make it so it shows the worker all the information on all the applications, make it a little easier for them to be linked together and show it to the caseworker. And then we can probably go ahead to my next thing. We implemented this status tracker too. In the customer portal, like if you were a client, you went to go and look and say, hey, I submitted my application, where is it? So the status tracker has a little arrow system. They're little chevrons. And again, it's hard to make this look good on a PowerPoint presentation, but if you look on the next slide, you can see kind of how they transition through the process. So once the application is submitted, they'll be able to see that submitted status. And then the next chevron is registered. And so that's when somebody makes, either they'll link their application to an existing account or they'll combine multiple applications in that process. And then it shows when it's with a caseworker for review. It shows when the client actually needs to provide additional verification. And then it'll show when it's complete. And that last one there actually shows application linked. So if you submitted 3 and you went and looked at your second or third one, it would show that this application has been linked to your other submission that gave you all those submissions.
How long the process does it take
To get through the whole
to
thing?
get through the whole thing?
That is a good question. So for some folks, it can be very quick and we can approve, like we actually have real-time eligibility for Medicaid. So if you fall into the parameters of, it's usually income-based and no disabilities, no things that need to be verified outside of what was provided, it could actually be processed automatically by the system. But as as cases get more complex, if you have a lot of people in your household, or if you have medical like disabilities or things like that, those ones can take a little bit longer to process. There are standard of promptness around all this that are set by our federal regulators. So, SNAP applications, 7 days if they have no resources. Some of our pregnant women, Medicaid, 10 days. But some of the other ones, disability terminations, we have longer, 60, 90 days to process, depending on kind of what categories they fall into and depending on where we are with the work. So we're, in a pretty good spot with SNAP applications right now and renewals and Medicaid applications. We still have a lot coming up with Medicaid redetermination, but getting back to where we're processing things, pretty close to when they're submitted. So I wouldn't say one gets approved. Some folks do get approved in a day or two, but some folks it takes a little bit longer based upon household, the conditions of the person and the folks in the family.
The only thing that seems confusing to me is the number of times that they go in and apply.
Mhm.
If I go on and Scott sends me a document and
I
sends
said,
me a document
hey,
and all that, but some way that's all got to merge, doesn't it?
Mhm.
And so there's obviously the kind you can't change,
Right.
but the kind that merges with others.
Right.
So have you looked at that?
So in that same change I was talking about duplicate application, CR as we call it, one of the things we looked at was that exact same thing happening. So like say you went in to apply last week
Mhm.
and they asked you for a document and didn't have it. And then you come in the next week and you apply and you do have it. And you submit another application that includes that paycheck or whatever we were asking for. That was a big problem for us. So one of the things we do now is when they're doing that, we prompt them, hey, you have an application. You don't need to submit a new one. You just want to tag it.
Yes.
So we have to allow them to apply as many times as they want. That's like a thing that we can't get around, but we are prompting them though. When we can tell it's the
They can't
same.
say, okay, you've already done this.
Yeah, you have to create an account
Yeah.
to submit an application. And so you can, again, I could go in and create 2 different accounts, and then submit 2 different applications. That's possible. But hopefully they'll come back and they'll remember their username and password, and we can then show them, hey, this is your application. You can just add your documents to that. So we did add that as well. So that folks will hopefully be less inclined to apply every time they need to upload a document, and they can just tag those documents to their existing applications. So it is possible, and then linking all the applications
Well,
together helps with that.
And I don't mean to in any way think that y'all hadn't done all that stuff, but I mean, literally, if y'all ever try to find a dog sitter, okay, I was doing that. And I did all the information, and I had to have my daughter's dog. Of course, they just maybe to do it. But, I had to have the vet information, and I didn't have it. I had to get it from my daughter. So all I did was just go, get wow something, I don't know. And but so I had to go out completely the document,
Mhm.
and then I went back in, and then was able to upload that same document. But it didn't make me do another one.
Because it could find it by the unique identifier.
Yeah,
Yeah.
yeah. So to me, if that's the same, so simple. I know it's not, but maybe if you go onto some websites like that, or Handyman Fix It or something, you gotta, the technology's there.
Right. And we do that. We give people client IDs, we give them tracking numbers for their applications.
If they lose
We
all
act-
that, though.
Yeah, we
okay.
actually
Yeah.
started texting people too, and they
Yeah.
submit an application, we send them a text right away that's like,
Mhm.
you got it, here's your thing. If you need to add stuff to it, you can click on, the links and stuff that we provide. So all of that together hopefully will reduce some of that duplicate. And then if we do get duplicates, they'll be easier to look at.
Good.
Together.
My next question is, supposing something changes in their status.
Mhm.
They're no longer eligible or something changes.
Okay.
Or is there some way we catch that, or we don't catch it, or does it just go on continuous?
There are. So, built into all the programs are renewals, and that renewal time period is usually a year for Medicaid, and it's every 6 months for SNAP. And there's some instances where it's longer for elderly folks and stuff like that. But we also there are a number of interfaces we have access to that will, if we get a ping from that, it can trigger interaction with the client as well. If somebody gets a new employment or new jobs, they're supposed to report that to us, and we have ways of checking that
Okay.
as well. And sometimes if you're in multiple programs too, if you're up for renewal for SNAP, and usually we align those renewal timelines, but because SNAP gets renewed, or we check in with them every 6 months, if your income changes so dramatically that you're no longer eligible for Medicaid, that's taken into account as well. So
Okay.
whenever we learn new information about the clients, that's an opportunity to act on it.
Another weird question. If I get locked up for drunk driving, all right, and does that change anything? In other words, I'm in jail.
If you're incarcerated, so if you're going to stay there for a while, it will affect your
If he
medical
can't make
coverage.
bond, he's gonna be there for a while.
It will affect your.
Thank goodness I don't know about that.
It may also change your income though, but probably in a way that would make you more qualified for government assistance instead of less qualified.
Okay,
So there's a lot of things that could go into that.
okay. All right, a general question I've got for you is,
Sure.
with the change in all the federal DHS stuff, how is that gonna affect state and all the money that we are getting from feds?
Sure. So a lot of our, all the programs I was talking about are federally run programs. So,
Right.
so far there hasn't been a major impact to us. We're obviously watching it very closely. Medicaid has been talked about a lot. SNAP has been talked about a lot. TANF less so. But you know, all of these are federal programs, so there's a potential for the federal government to change this program.
On all the Doge stuff, have they identified any abuse with DHS monies? Have you been tracking that?
So we've been watching very closely. They haven't removed or made any big changes to Medicaid, SNAP, or TANF yet. LAHEAP, the low income housing or energy assistance program, a lot of the staff from that program at the national level were all let go.
Okay.
I don't think there's still some regional folks. So we've already got our money for that program for this year. So no immediate impact, but we definitely
You're
continue
watching
to
all that
monitor
stuff.
it. Yeah, it's been mostly staffing changes.
Okay.
You know, our state officer at CMS left and now he works for DCH actually. So there's been some positive benefits, that there are some new qualified people in the job market. But as far as impact to the programs, you know, the head of USDA has definitely put out some messaging that's very, I would say, pro states that are looking to do initiatives like we have some technology things that we're trying to
Right.
push, and that was maybe a struggle in the past where it'll be easier now in the future. And SNAP fraud has been a big issue, and so they're very focused on that and willing to work with us on initiatives that we want to do to combat fraud too. So far, you know, it's been kind of not a lot of big changes to my programs yet. But I do, you know, a lot of them will require legislation, I think. And
But
so,
I think the fraud certainly, not to say that y'all are any worse than any other state or agency, but I would encourage you to, I mean, you already are working on that,
yeah,
but I'd love to hear a report on fraud, maybe next time.
yeah, and that's a topic that I definitely can provide some information about. You know, it is like you're saying, it's a national problem, not a Georgia problem, but you know, there's a lot of stuff that we can and have been doing to increase security, working closely with Conduit, who's our EBT vendor. We've been working with local and national law enforcement too, and some of that I probably can't share with, you know, in this public of a setting, but maybe we could share
Yeah.
something, you know, in a more private setting. And then, you know, FNS too has been engaged as well. And so one of the big things that there's a pilot right now in California and Oklahoma to do chip cards. You know,
Mhm.
they're all mag strip still. For the EBT is a separate payment system than credit cards.
Right.
And so that's something we've been looking at for a while and are developing procurement things around
Okay.
too. So there's a lot going on there. that
You
we can
just sort
share
of
with
give
y'all.
us
Yeah.
a public update on that.
For sure.
And
Appreciate it.
For sure.
hopefully it don't turn into something they can sell on the street.
Right.
If you turn it into they make money on it, they don't use it themselves, they turn around and they sell it for something else. You know?
We're always trying to-
I'm concerned about that. I mean,
All right. All right.
Oh, yeah, sorry, I had one more thing. We got
Right.
a little, legislature passed raises for caseworkers and supervisors. So that's great news. You know, one of the things I think I presented on a lot is retention, and this is you know, will be a big help in that area. So happy to see, you know, we had the House Appropriations Chairman actually came to a disaster SNAP site. You know, he's from Dublin, Lawrence County, and saw the disaster SNAP site we had there and how well it was going and serving lots of people. And I think that was a direct contributor to, you know, a lot of the other legislators too, not just him, but a lot of folks were involved in helping us spread awareness and actually found some locations and things like that. So they really got a chance to engage with us and see that good work. And I wouldn't say that's the only reason they got a raise, but it was definitely
Didn't hurt.
great to have state leadership acknowledge the hard work of the Office of Family Independence. So
How are we doing on retention now?
it's gotten better. We can share with you some year over year.
Because it was
stuff.
20% before. It was.
Yeah, I think we're down like, I think we're down at least 4%
Okay.
for where we were last year
Okay.
around now, but that's again some statistics we can work with you to share
Be good.
charts and stuff to
Love
show
to see
you
that.
year over year.
Mhm.
It's definitely going in the right direction. Been happy about that. I still would want it to be lower, but you know, hard job
Mhm.
to do, and but we're trying to make it a better job.
Good.
for folks.
Thank you for your hard work.
Yeah,
one,
thank you.
that one less
Yeah,
thing.
yeah, no, sorry. I'm happy to
That's
stay.
one thing about the work that y'all did, DSNAP, that we attended and watched the work. I mean, that was something else. I mean, I still haven't seen it. That's almost like when you could pick up and move around the state like you did and handle that many applicants. I mean, it was just phenomenal. Did a great job with that.
Thank you.
And please let the staff know that.
Yeah, the team did a great job. They deserve all the credit too. They really showed up.
Had good leadership.
Thank y'all. Appreciate y'all coming out. That was
Great.
nice.
Thank you.
Thank you.
All right, so, Division of Aging, Mary Lee, come speak to us. And just,
Actually, I've got two of my team members.
Okay. and just so that others know, you need my seat too.
No, I'm not staying up here. I just
Oh,
wanted
okay.
to-
Well, before you get going, I just want to thank you for, Wes, you and Jack, y'all, tell them what you're doing with Mary Lee. I mean, with, Mary Lee, how she's helped us.
Oh, yes, so it's been remarkable. We've been having regular meetings in our subcommittee, and we're learning a lot about the various programs across the state, the things that we're responsible for, the things that we're engaging cooperatively with in the public sector, and the not-for-profit sectors, or private sector, I should say, as well. Keeping us up to date on all of the great programs and the challenges that we have ahead of us. And it's been a great introduction to the passion of the people that represent us out there. So a very rewarding subcommittee work for us.
It's good. And we'll hear more from those folks and you guys about
Yes.
that aspect of what they're working on later. But thank
Well,
you.
Chair Smith, and a shout out to the Board Aging Committee, because you all have just jumped right in, and they actually went to visit their local area agency on aging to really take a deep dive into what we do. And so really appreciate that. And that is actually the impetus for this presentation.
Sure.
Because we presented a larger, longer presentation on this topic to the Board Aging Committee, and they felt like this would be helpful for all of you. And so I'm really excited to have two members of my team here today. Allison Bernal, who is our Livable Communities Section Manager, and Yolanda Mendoza Miller, who is a team lead on that team. And they're going to share with you about our Title III programs and services. And those are our largest block of funded services through the Older Americans Act. And really are the core of the work that we do at the local level to help people age in place. So I'm going to turn it over to these two capable team members of mine.
Thank you. Thank you. Well, good afternoon. I'm Allison Bernal, like Mary Lee said, and I am the manager of the Livable Community section. So our section primarily oversees all of the Older Americans Act programs, plus we have the Senior Community Service Employment Program and also the State Plan on Senior Hunger. So, but those are in addition to what we're going to be talking about today. So next slide, please. Just wanted to give you guys a quick snapshot of where our area agencies on aging are in the state. We do cover all 159 counties. But our AAAs are strategically placed so that we can serve the most people as possible. So next slide. Okay, Title III of the Older Americans Act. This is just a quick education for you. It authorizes grants to the State Unit on Aging. The Division of Aging Services is the State Unit on Aging. And it gives us the ability to coordinate programs for people, for the most part, who are 60 and over. There are some times where we can serve people younger than 60, but it includes supportive services, which we'll be talking about, nutrition services, which we'll be talking about, caregiver supports and preventative services, and we'll be going through all of that today. As you can see on the right, this is just OAA funding. Now this is total, this is not for Georgia, but about 72% of all of the Older Americans Act funding is Title III funding. Next slide.
Okay, all right. I'm Yolanda Mendoza Miller, and I will be talking about the Title 3B in-home services. So under the OAA, 3B provides supportive services, and some of the most common services we provide are personal care, which include self-care activities such as dressing and undressing, bathing and toileting. Homemaker, which include activities such as light housekeeping and shopping. Chore services, which are activities that are performed once, seasonal or occasional in nature, and that includes lawn care, cleaning the walkways of ice, snow, or leaves, and sometimes pest control. Home modification and repair are minor home modification and repairs intended to help clients remain in their homes safely. And some examples are ramp installation, widening of doorways, and weatherization. And lastly, assistive technology. It's not like the other services, but more of a tool that can be used to assist older adults live in their home safely longer. Assistive technology is any item, piece of equipment, or device. And some examples of assistive technology are canes, walkers, wearable GPS tracking devices, medical alert devices, and automated pill dispensers. And in addition, some of the AAAs have other fund sources that can provide assistance to older adults with emergency financial needs, such as paying a utility bill, rental assistance, or groceries.
Can I ask you, is that all based on need? Do they have to be on Medicaid, or is it how does this work?
This is all non-Medicaid. Sometimes people refer to it as pre-Medicaid.
Yeah, I got you. You understand what, I'm just trying to figure, is there some type of monetary gauge with this?
Eligibility question.
We,
Yeah,
we-
who's eligible?
who's eligible is 60 and over or 55 and over for the CSET program. Yeah. And we do assess every client for need. We assess their functional abilities,
Right,
what they can and cannot do. And we also look at something called unmet need. So if they cannot feed themselves, is there somebody around them who can help or no?
mhm,
And if no, then we can provide that service. Now, we are not means tested, but we do offer a cost share or private pay if
mhm.
the person has the means to do so.
Okay,
And while we are on this, are these benefits equitable across all the AAAs, or are there certain ones that don't get any of these?
That's a good question. And the answer is it varies. Where we would like to be
Mhm.
is all AAAs offering all services, but
Right.
that's just
That's
not
where
the
we would
case
like
right
to be.
now.
That's a
Yeah.
function of what they can do,
Yeah.
Right,
not what y'all can do.
correct,
Okay.
correct.
Provider availability as well.
And workforce is an issue.
Yep.
And so that plays into it, of course, especially with home modifications. We call it home mods for short. The AAAs that offer it tend to be in the more urban areas, the rural areas. It's a little harder.
Right. Yes.
But our largest programs, nutrition, personal care, homemaker, all AAAs offer those services. Yeah.
Okay, previously, the Code of Federal Regulations 1321.3 restricted home modification to a lifetime allowance to $150 per person. In October of 2021, a waiver was requested by the Division of Aging Division of Aging Services to the Administration of Community Living to increase that allowance to $3,500. In March of 2024, DAS increased the funding limit to $5,000 without any provisional conditions. And any modification or repair as highlighted in our current policy, Manual 5300, Section 314 of $5,001 to $10,000 must be approved by the State Unit on Aging Director.
So let me just, that's a really big deal because we used to could only spend $150 on a home modification. It's ridiculous, right? So now the AAAs have the ability to spend up to $5,000 on a home modification. And any more than that, Mary Lee just needs to sign off on it.
Okay.
So we were very excited about that.
We build a lot of ramps.
We built a lot of ramps.
Is it still, the whole, they gotta be a AAA contractor or whatever the designations are? Is it hard to find those kind of people that meet our requirements
Mhm.
in the office? Okay.
What we hear a lot, or often, and especially since, the Hurricane Helene, came through Georgia, that, the contractors are doing the bigger jobs.
Sure.
They're not wanting to commit to, a small $3,000-4,000 job in their eyes. So that's become a little bit difficult, during the last few months and upcoming months as well. So as Allison mentioned, 6 of the 12 AAAs are providing home modification and repair. Wheelchair ramps followed by grab bars, which are typically used around the house, mainly in the bathtubs and bathrooms and showers, are the most common requests. Home modification and repairs allow older adults to age in place longer and safer. And building ramps often bring many community organizations and community members together. We often hear there's volunteers from churches and Rotary clubs that like to join in and build the ramps. Boy Scouts too, they get the little merit badges by helping build these ramps.
Eagle projects.
Yeah, exactly. And some of the challenges, like we just mentioned, are finding licensed contractor to do the smaller jobs. Another challenge is liability of finding additional repairs. So meaning they're going in to install the ramp, but perhaps where they're attaching it to the structure of the home or the property may not be the safest. And so there's more repairs that they need to do. And then next slide, please. Chore services, as we mentioned earlier, they are non-continuous household maintenance and assistance in heavy housework, yard work, or sidewalk maintenance for an individual to maintain their safety in their home. Some of these examples are decluttering of the yard and sometimes decluttering inside the home as well. And that's meant to sometimes that's just decluttering the home, but also moving or rearranging the furniture so that they have a safe way to move in and around their home, and pest control.
Is this picture to show you what you don't do or what you do?
It's sometimes we do that.
Bless your heart. That's all I say.
That is sometimes what we do. And oftentimes I've heard many cases where a family member moves in temporarily and sometimes they bring along bugs that they didn't, or sometimes they have a hole in their basement or somewhere and the bugs come in. And so it's all of those things that we help our older adults here in Georgia.
True.
But
And
a caseworker
hoarding is
would
a
be
real
involved with all that.
Oh,
I mean,
yeah.
this where is what's the word that y'all use? Declutter. Where does decluttering stop and hoarding?
Right.
Right.
Right. I mean,
Decluttering is kind of our nice way of saying hoarding.
okay.
But to add to that, the missing component for that goes along with hoarding is the mental health aspect.
Yep.
So we can go in and to a person's home and declutter it, day after day after day, but without that additional support of mental health resource to help manage
I get it.
their health issue, it's sometimes, it's an uphill battle.
Yeah.
So that's the missing component.
Okay.
Next slide.
Okay, so our largest program that we do is the nutrition program. And this has two components to it. There are meals that a client can get out in the community. Typically, those meals are at a senior center. But we do have one AAA, the Southwest Georgia AAA, SWEGA is what we call it, and they have contracts with restaurants. And so the client they get a voucher and they can actually go to a restaurant and get a hot meal on the day of their choice, when they want, how they want. They can order off a menu. And that has been wildly popular, as you can imagine. Yeah.
Yeah.
In fact, Sawega had to stop enrolling people into the congregate nutrition program because there just wasn't enough funding to serve everybody who was coming out of the woodwork to get this service. We also do home delivered meals, which is sometimes lovingly referred to as Meals on Wheels. I'm sure you guys have heard that term. This is a meal delivered to a person's house. And we do offer more than a meal. And I have to stress this, you know, we really promote socialization. We promote health and wellness. We're not just giving somebody food, we're giving them a nutritious meal. We're also allowing them to socialize with other people. And we provide monthly nutrition education because we only serve one meal a day. Well, they've got 2 more meals they've got to eat. So we provide nutrition education. So hopefully they continue to make healthy choices. Just wanted to show here on the screen that we do serve a lot of people, about 30,000 people last year. However, we have 3,500-ish on the wait list for meals, which we don't like. And not every AAA has a wait list. But the ones that do, clients are waiting on average about a year to get a meal. So, you know, that's,
But once they get on, then now they're on, right?
they get reassessed annually.
Okay.
Yeah, reassessed annually. Mhm.
But that's all, that 3,580 is for the whole state, right?
For the whole state.
Okay.
Yeah,
Have they been assessed already?
they've been assessed.
So they're in need
They're in
and we're
need.
not providing that service.
Correct.
Is it funding?
It's funding.
Okay.
Yeah, it's funding. Okay, next slide. Okay, I love talking about our evidence-based programs. So Title 3D is evidence-based programs. Are y'all familiar with evidence-based programs, or do I need to give you? You are. Well, of course you are.
I'm not sure.
In education,
Okay, yeah.
we do it in education.
Right, exactly. So evidence-based programs have been scientifically proven to work and can be replicated in the community with the same results over and over again, right? So we have many, many evidence-based programs. We have chronic disease management programs. We have falls prevention programs. We have evidence-based programs in Spanish. We have all kinds of things. And if you go to the website, georgiahealthmatters.org, you can see and get a description of all of the programs that are offered, where they're being offered and how they're being offered, if it's virtual or in person.
And we do have to brag that we were able to transition from in-person pre-COVID to
Virtual.
online, virtual,
Yeah.
while COVID and even now still offer it as an option.
I'm curious now. Some of our seniors and they have a disability. How does that work? Because I, you know, some of them can't even operate a phone. What are we talking about? That's concerned about. How
So
do you?
there's a couple of things that we've done to help alleviate that. Some of the AAAs have even offered simple, it's even called a grand pad, which is basically an iPad, so to speak, and it's very simple. It's press the button and here it launches the program. So you can either go online and it's like a pre-recorded and they can do that. And sometimes we've even provided like the mobile Wi-Fi for them to be able to join the class. We do also provide some transportation if they need to go to a physical location to do the class. So we do provide those transportation services as well. But the one thing that even with the GrandPad or the iPad or whatever they have used, it also provides an opportunity for engagement for some of these older adults who may not have anybody. So it's kind of multi-purpose. They're able to do the evidence-based class and still join in do some other kind of socialization activities on the pad. So it's all programmed, and just to kind of limit them and not having them to be able to fumble on how to use the device.
This is for people who are basic still independently living, correct?
most of the people we serve are still independently living.
Mhm.
Yeah, we get them pre-nursing home, right?
Well,
And the goal is to keep them out.
Right.
Exactly, exactly. But for those who have disabilities of any sort, we
mhm.
do have evidence-based programs to help them. For instance, I'll just give you a quick example. We have a program called Vivo, which is a live strength-based exercise program. So the teacher can see the students can see the teacher, and they can make those live modifications. So they get to exercise either in their home or at a senior center, but the instructor, who could be anywhere, can see them and make those modifications as needed. Mhm. Okay, next slide. Caregiver services. As you all know, unpaid caregivers are, yes, that's all you need to say. Yes. We offer all kinds of supports for caregivers, for family caregivers. We have support groups. We have adult day services. This is kind of like a senior center, but for, those who need adult day services with a nurse on staff, they can get that. And respite services. Respite services it could be where the caregiver, this is where it gets a little confusing, but if the caregiver needs respite from cooking, then the care receiver can receive a home delivered meal to give that caregiver respite. Does that make sense?
Sure.
And it's the same thing with personal care, with bathing, with grooming. It's respite for the caregiver, but the care receiver actually gets the service, right?
Right.
And in that case, the whole goal again is to keep people out of nursing homes. So if the caregiver can continue those caregiving services for longer and not place in a nursing home, that's what we want. So, and everybody needs a break every once in a while. Caregiving is hard work. If any of you have ever been caregivers, even if it's for kids, everybody needs a break every now and again. Okay, next slide. Okay, there's a lot on here, and I didn't realize it was going to be this small, so my apologies, but wanted to let you know, if you look over to the right, the clients that were served last fiscal year versus the average cost per client, which is right below that. So for about $2,800 a year, we can keep a client out of a nursing home for about 3.5 years.
Wow.
That's great. That's great, right? Yeah. So it's huge. That's right. That's right. So y'all know how much a nursing home costs a month, right?
ma'am.
Yeah. It's a lot. So for $3,000, we can keep somebody out of a nursing home for 3.5 years. That's a huge savings to the taxpayers.
Yes.
Yes. Okay, next slide. I'm not going to go through all of this, but we want you to know where the AAAs are and what counties they serve. You can flip through these. And then we also have the Centers for Independent Living. We call them our CILs. Our Centers for Independent Living focus more on the disability side, and they also provide that assistive technology that Yolanda was talking about, but they have other resources as well. But our Centers for Independent Living and our AAAs, they work very closely together around the state.
Let me go back to that number you just shared about the $3,000.
Yes, sir.
All right. Obviously there's the personal financial help of the citizens of Georgia that don't have to go to the nursing home with that. This $3,000 the state pays,
Yes.
the $2,700 the state pays, that helps me not to pay $7,000 a month.
Mhm.
All right. But when I do end up going to the nursing home, a large percentage of those are 100% paid
Medicaid.
by the government, right?
Mhm.
Federal or state?
Federal.
Federal. So the state
They're
doesn't
usually
pay.
Medicaid.
Right. But
Yeah.
the state doesn't necessarily pay for that, but
I'm sorry.
That's right.
What did I say? I'm sorry. You know what? I
no
apologize.
problem. It is paid by the state.
Yes.
And so that's saving the state money every month that we
Mhm.
can keep those folks out.
Correct.
Isn't there, a lot of the nursing homes will not accept Medicaid, in the local state, health, right?
Private ones.
Private. I mean, that's, what percentage of nursing homes out there are just, state funded?
I mean, I don't know that this is my area of expertise, but most nursing homes, when you're talking about long-term care, do accept Medicaid. And they also have Medicare beds for rehabilitation. They get more money for rehabilitation beds. So they tend to have a larger number of beds that's for that short term, like post-acute stay, 90 days. But they have Medicaid beds for long-term care. And I should have said Medicaid is actually, as you all know, there's matched to Medicaid
Yeah.
federally. So it's
Yeah,
federal
yeah.
state.
But it is state,
dollars
that's cost of state
and
though.
that, but it's a big cost to the state when someone goes into a Medicaid nursing home bed, to our slides point. But if you're talking, a lot of people get confused because there's a lot of private pay assisted living. That's a different type
Yes.
of care.
I was gonna ask you,
That's more private pay.
I was gonna ask you the definition of a nursing home, versus an assisted living home. And when you say most nursing homes take the Medicaid, that's one thing, but a lot of the assisted living don't, just like you said, right? And so, is there a list of the nursing homes in the state of Georgia?
Mhm. Georgia Healthcare Association has that.
Okay,
And there's something called number 2 care, I think that's their
Okay.
website, and that'll show you all of the licensed nursing homes.
so when somebody comes up to me and says, oh, I can't find a nursing home for my dad, my mom, whatever, then, I can send them to that website, I guess. Or,
You can. Or you could say, do they want to go to a nursing home or would they rather stay at home?
right. Okay. All right,
Just a lot of people don't know that these services exist
Mhm.
outside of, the OAA, that they just don't know they exist.
right. Okay, thank you.
Absolutely.
We're also seeing a lot of changes in this area. There's a lot of financial distress
Yes,
in independent living, assisted living, the skilled nurses or nursing home area.
yep,
And so it's in turbulent times right now. We have an increasing rate of bankruptcies being filed and movements by private equity that take kind of a holistic approach. They want to get you an independent living,
Mhm.
right? And they work you through the various phases. Because of course, an independent living and even assisted living, less $1 intrusive, right? It's just cheaper than when you get to a skilled care facility. So there's so many things that are happening. And the system as it's designed right now from a financial perspective is broke. So we're going to see a lot of these issues percolating as we start to rely more and more on this kind of structure.
Yeah.
Particularly in the Southeast. So I don't think Georgia is going to be immune from those repercussions. Which highlights the importance of keeping people in their home safely as long as we can.
As long as.
Which leads me to something else. My heart is bothering me about the 3580.
My heart too.
I can't turn loose the fact that 3,580 people aren't eating nutritional meals in this state. I mean, I've been engulfed in the math trying to figure out, maybe you could help me. How much does it cost us on either, let's say, a monthly basis? They're getting one meal a day. I'm trying to get the magnitude of 35.8, let's say 5,000. It's underestimated. People will get frustrated because I'm sure you tell them, well, you're going to go through this process. You're probably going to put on a wait list. And they're like, yeah, I've heard that before. And they end the process. If you could give me an idea.
I was gonna say, the 3580, those are the people who were able to contact us, get assessed, be determined to be in need, and then put on a wait list. There are so many people out there who have never heard of us, right?
Right.
But financially, I mean, a meal, the cost varies depending on what area you're in. But a meal
Some of
is
that
6 to
information.
$8, you know what I
Right,
mean?
I know, but you got people who've got to deliver and you got to have a. kind of
Oh, there's a unit
platform.
cost, yes,
Yeah,
for
yeah,
all
yeah.
the things that are involved. Yeah,
Right.
and I don't know that exact number, but we have reports.
If
For
you could
that?
get that for us.
Yeah, we can share that and also, because we have a uniform cost methodology, so there's a unit cost per AAA
Right,
also. But I did want to mention that since the session ended Friday, our Coalition of Advocates for Georgia's Elderly Co-Age, which is a part of the Georgia Council on Aging, which is the attached agency to DHS, they did advocate for home and community-based dollars that could be used for meals.
Mhm.
And there was 1,099,000 added. And so that will take some of those people off the wait list, if signed by Governor Kemp. So we're lucky to have the Council on Aging advocating each year. And every year they call and ask us, and all throughout the session, they're knowing how many people are on the wait list, what, areas of the state are they, and they're using that data to help advocate. So we are going to take some of those people off the wait list come this next fiscal year. I just want to make sure you knew that just happened, Friday.
So we have like a home modification repair. We've been very successful. You've taught us this in the subcommittee meetings, working with community-based organizations.
Yeah.
Can we do something like that with home meals? Can we work with community-based
Oh, we
organizations?
do.
We do,
Okay.
yeah, we do quite a bit of that. So that money is leveraged. Most of our meal providers are serving a broader audience in their communities.
Mhm.
It's just our dollars are serving the specific folks who come through the
Sure.
Aging and Disability Resource Connection. And that might be another, I've done that before, gone out with some home delivered meals, to deliver the meals. And that might be something we could set up for you all too, if you wanted to do that in your region. So you could actually see how it works with one of our providers in your area.
That'd be great.
Cool.
And for
Love
those,
that.
and
Yeah,
for those
that-
community partners that don't actually provide the meal per se, they
Mhm.
offer food banks.
Right.
So for individuals that are still needing assistance with groceries or not, we have been very lucky that our AAAs do partner with them and are able at least to provide them a resource to get at least food, whether it's canned goods or whatnot, with their local community partners.
Mhm. Well, I feel better, but only a little bit. I appreciate all you do, but it's like, it's heartbreaking to think that, in a state, in a country of our magnitude, there's a difference between, being, it seems like something that we could solve if we wanted to solve.
Yep. I believe so.
Yeah, so we didn't put it up on the slide, but this month is actually Senior Hunger Awareness
There
Month.
you go.
Well, I'm aware.
And I know, so, next Friday, which is the 11th, this Friday, oh my gosh, how did
Today's
that
the night.
happen? How did that happen? If you have something orange is the color of Senior Hunger Awareness Month. You can wear orange, take a picture, send it to Mary Lee. We'll put it in the newsletter.
And communications has some posts that are happening on the
Yes.
DHS social media page, if you'll help share those.
Yes.
Are there any special events that are feeding
We,
elderly folks?
every day, yes.
Besides that,
Yes, but also the governor signed is a proclamation first. It's at the end of the month. So it's on the 29th, I think. So we'll be at the Capitol for a photo with the governor and his wife.
Good.
Yeah.
And we used to have the annual senior hunger.
Yeah.
Summit.
Council,
Uh,
Council on Aging that,
Yeah, and we don't have that anymore.
No, we don't have that
that
anymore,
helped
unfortunately.
Get all the information
Yes, it
out, the
did.
things we
Yep.
need to do.
What we do have are senior hunger coalitions
Mhm.
that are anchored in each AAA.
Yeah.
And they meet at least twice a year, but most of them meet quarterly. And it brings together everybody who works in that space of hunger to come together, to collaborate, to learn from each other. And what we thought is that it would have a bigger impact if we had these coalitions at the local level than trying to have a senior hunger summit at the state level, trying to get everybody from Georgia up to Atlanta. Instead, we have these coalitions all throughout the state now. Yeah. Yeah. But we would love for you to deliver some Meals on Wheels. So if that's something you're truly interested in, okay. Okay.
Great.
Yeah.
Wonderful
We
experience.
appreciate y'all's heart as well as your activity and your work.
Thank you.
Thank you.
Right.
Right? All right, we have one more. Sarah is gonna come for Child Services, Division of Child Services. There you go. Okay.
How are you?
Good.
Great, thank you.
Well, good afternoon. My name is Sarah Hurst, and I'm happy to present to y'all today on behalf of Division of Child Support Services. So today I'm going to be sharing a few updates on a couple of our grants, as well as an overview of one of our enforcement resources and a quick performance update. So starting it off with our grants, I'll start off with our Safe Access for Victims Economic Security, or SAVES grant. Now, y'all heard about this grant back in October, so I won't spend too much time here, but I did want to provide you with a few updates. So on the next slide, you'll see our goals and objectives. So back in 2022, Georgia was one of the 13 state and travel child support programs awarded a SAVES demonstration grant by the Federal Office of Child Support Services, or OCSS. Research shows 90% of domestic violence survivors want child support if they can get it safely. So through the work on this grant, our goal is to implement comprehensive domestic violence services to survivors who need assistance accessing child support. The SAFES grant plays a key role in enhancing safety and economic stability and helping survivors leave and stay away from abusive relationships. And then on the next slide, you'll see a roadmap of our grant activities. So I'll just touch on a few items on this page. So training has been a really big focus of the grant. We partnered with OCSS as well as the Georgia Commission on Family Violence to deliver training for all of our DCSS employees. So that's something that started at the beginning of the grant, and we're going to continue until we have everybody trained and we have a plan for ongoing training. So the training series consists of 4 different sessions that focuses on the impact of domestic violence on parents in the program and how domestic violence dynamics impact effective delivery of child support services. The training looks at domestic violence through the lens of what a child support worker does and builds knowledge and skills to more effectively deliver child support services to victims of domestic violence. And so far, we have 519 DCSS employees who have been trained. And again, we'll continue with those efforts. And it's a really eye-opening training. I went through it in one of the first cohorts, and I used to be an agent when I first started with the division, and just thinking on how the different activities throughout the life of the case, something that may seem as simple as going to court. If you're a survivor of domestic violence, that's a very terrifying experience, potentially being back in the room with the person, the perpetrator. So, and then in February 2025, we implemented the pilot of our triage team for the Family Justice Center in Waycross. So the offices participating in this pilot include our Waycross, Brunswick, and Jessup offices, and that encompasses 11 counties and 2 judicial circuits. So as part of the pilot, we are reviewing how our current workflow and processes may need to be adapted to increase safe access for survivors to apply for child support, and also just throughout the lifetime of the case. As I mentioned, there's different actions that may happen that we may need to consider for their safety. The triage team will collaborate with direct providers of services to survivors in the area, as well as the Family Justice Center. Then also in February, we implemented some outreach to hospitals and birthing facilities to provide educational information about our DCSS services as a whole, but also specifically the services offered under the SAFES grant. So on the next slide, you'll see some of our key partners for the grant. And I wanted to give some special acknowledgements here. The Ahimsa House is an organization that's dedicated to helping survivors of domestic violence and their pets to reach safety together. And then the Haven Battered Women's Shelter. Both of these organizations have participated as subject matter experts to provide feedback and expertise during the training sessions that we've had with our employees. So that's been really great to hear from them since they
Who was the
provided.
second one? The Haven?
Yes, the Haven Battered Women's Shelter. And then I also want to acknowledge the Family Justice Centers in Waycross, Macon, and Marietta for their partnership. And then I also wanted to mention, we have a couple of partners on the DFAC side, Laura Beggs and Melinda Mewborn, who have both participated in conversations with us and helped us on this grant. So then on the next slide, you'll see some resources, resource information on our SAVES grant. So there's a screenshot of our website on the left side that has a lot of good information for survivors or those that are interested in potentially coming to us for services. We have a QR code to make it easy for customers to access the website. And then we also have an email address that anybody can reach out to if they have questions about the grant or our work in this area. So next, we'll take a look at one of our other grants. It has a very long title, Charting a Course for Economic Mobility and Responsible Parenting. We refer to it as the Responsible Parenting Grant for short. So it has been a couple of years since we presented to the board on this grant. It was awarded back in 2020 to 8 states, and this grant will continue through September of this year. The objectives are to provide information and education to young adults and youth about the legal, emotional, and financial aspects of parenting and information about our child support processes. So on the next slide, you'll see some of our key partners for this grant.
Next question. When the grant runs out, what happens?
So one of the key parts of this grant was creating an educational curriculum. And so our plan is after the grant funding runs out, we already have the curriculum available. So we will make that curriculum available to the public, any organizations that want to use it. So really most of the work related to this grant is being done during that grant period. And then the result of it is this curriculum that basically any organization that has young adults or youth that they want to provide this curriculum to, they'll be able to use that.
In a public school situation for high school, who would be in charge of getting this program in the school, or just a class or a course?
So our goal is to make the curriculum available out like on the website, so that way anybody could access it. So if someone from a school was interested, they'd be able to access it there.
Yeah. You would have to let them know.
Of course.
A lot of schools will know.
Right. Yeah, there'll be a big educational component.
That's great.
Yeah.
Do we have a number of, do you have an idea of how many users we have now?
So we're getting ready to deploy it with a pilot group. So with that pilot group, it'll include some individuals who are either in foster care or aging out of foster care. And then we're also partnering with the Department of Juvenile Justice. So some that are involved with that program. So I don't have the number offhand of how many students total will be part of that initial pilot. But then once we do the evaluation of that pilot, then basically we want to make it available to as many students that can take it, want to take it. They'll have that.
How long do you think the evaluation will take to come back where you have?
Sure.
Yeah.
So we're planning to roll out in July, the curriculum, and then the pilot would be completed. The pilot and evaluation process would be completed by September, is the goal.
You've referred to the curriculum a couple of times. Are you talking about a written curriculum with lesson plans and things of that nature?
So it's actually an interactive online training curriculum. And so it does have a number of modules. They're on the right side of the screen, but basically it walks the students through different scenarios that they might encounter, you know, as they move forward in life, different decisions they might have to make. And so it was created by Columbus State University. Also, they had some young adults who participated in the creation of the training to make sure it's engaging and the content is relevant to young adults and youth who will be taking it. And so it really was meant to be kind of, they refer to it as kind of a gaming interaction, which is really popular with that age group, to keep them engaged throughout the training.
So is it designed to be self-contained, or is it designed to where you have to have someone walk you through it like an instructor.
Facilitators.
Yeah.
Right. So they can manage through the training themselves. And in fact, there's also like a pre-assessment to kind of gauge how much knowledge they have on these topics before taking the training themselves. And then after we'll gauge, how much they've learned as a result of taking the training. So they can walk through the training.
So are we maintaining those metrics? Will we be able to assess them?
Yes.
That way? And could you in the future share some of that information?
Of course. Yeah, I'd be happy to. And we also are required to report back to the Federal Office of Child Support Services on the results of the evaluation. So we'd be happy to share that. And speaking of the evaluation, that's another one of our partners is the University of Georgia. So they're the ones that are going to do that evaluation for us, partner with us on that evaluation. So we'll get reporting out from them on that. And then I did want to mention, I know I mentioned Department of Juvenile Justice, the Division of Family and Children Services is one of our partners, and Christian City, which is a nonprofit organization that offers residential services and programs for homeless youth and young adults. So those are our kind of three key partners for getting students that will take the curriculum. I also want to thank our Office of Communications. They've been key in kind of reviewing the curriculum as well from a department standpoint, and our DCSS training and professional development team, our training experts also took a look at it for us. On the DFAC side, our point of contact's been Amanda Foster with the Independent Living Program. And so we are thankful for her partnership on this grant. And then on the next slide, you'll see some next steps on the grant. So as I mentioned, we're planning to deploy the curriculum in July. And then the testing and evaluation will be happening in partnership with the University of Georgia. And then of course, we'll have our findings from that evaluation to report back to OCSS and be happy to share that with you all as well.
So a real basic question, what's the definition of success for behaviors of people that have taken this course?
So our definition of success is we want to increase their knowledge and education in the areas that the curriculum will cover. So legal, financial aspects of parenting, aspects of our child support services program. I didn't know anything about the child support services program until I did an internship with another department within the state. And that's how I learned about our division. So I imagine a lot of younger individuals in that young adult youth age range probably have never even heard of Division of Child Support Services or know what we do. So it's, as long as we're increasing their education from the time before they took the curriculum till after, that's really the end result goal.
But it's more than education, and it's more behavioral of implementing the education stuff. So Jack's the educator of the bunch, but not me. But I would guess that not just because I get a degree in something, but am I able to get a job? Obviously, these are parents, right? So they already got a job, but I don't know how you come up with what the results that you're wanting to see in them. But I would encourage us to think about that.
Sure.
And try to come up with something, because we educated everybody. Yeah, they got better. But I would want, if I'm you, I'd want a little more proof than, okay, I just, X amount of people took the course.
Right.
I think that would help you in getting more money from whoever you got this from. So
Sometimes, it's a challenge, right? Because sometimes we only are able to measure that which we can,
I know,
as opposed to that which we're most interested in. We recognize that education is a means to being a better parent. And being a better parent is manifested in responsibility associated with things like finance and relationships and all of that kind of.
One of the measures might be, I've never had a car, but now I've got a car that is a secondhand car, but I was able to buy it, borrow the money or whatever. But that's what.
Functionality after they take the course.
So just, I know this job's world, not ours, but any kind of education program is more than just taking a test.
Right.
But I would suggest that besides those quantitative metrics, and again, you're the experts on this, just the increase in confidence, so the qualitative metrics as well.
Mm,
You know, how do they feel?
That's good.
about
Right.
being a parent? How do they feel? Are they better prepared financially? Are they better prepared
Well, emotionally.
emotionally?
Yeah.
Right.
Mhm.
Those type of things, so that we have a qualitative dimension. That to me, I think would be a powerful measure of success,
Yes.
right?
That's a great.
Yeah, I'll follow up too, because I know there were quite a few federally required parts of the evaluation.
Mhm.
So I'll dive a little deeper into that too to see, what are we going to have as our evaluation? Is it going to cover both the qualitative and quantitative, which I imagine it will. But I don't know specifically what types of questions they're going to be asking and what they're going to be.
It doesn't have to be in
looking for.
14 different categories, but
Sure.
just 2 or 3,
Right.
and that can go, yeah, he really got it.
Right, Yeah.
And the questionnaire could be, how did you handle this situation before?
right.
And then how are you handling it now?
Right. Yeah, and I know financial education is so key. I got it. I went to the University of Georgia, and that was the first time I took like an official financial class.
Yeah.
And I thought I should have had this in high school. I should
I mean,
have
how
had
to
this long
keep a
before.
checkbook?
Yeah, it's very,
Yeah. Pay the bills on time.
very important. So kind of switching gears, I wanted to provide y'all with an overview on one of our enforcement resources called the Child Support Lien Network, or CESLIN. We have a lot of acronyms.
Woo, you do.
CESLIN is what we call it for short, but
Okay.
the state of Rhode Island actually established CESLIN, the Child Support Lien Network, back in 1999. They had a federal grant at that time. And the purpose of the grant was to extract data regarding delinquent non-custodial parents, so those that weren't paying their child support timely, into an accessible, easy to use database for the purpose of asset matching, specifically being able to intercept settlements that could then be paid towards their past due child support. So following when that grant expired, basically it became open that other state child support programs could take advantage of that work that was done through that grant by entering into an agreement with the state of Rhode Island, who serves as the host state for CESLIN. And so since that time, and today, the majority of state child support programs do participate as members of CESLIN, and Georgia is one of the participating states. So we currently receive matching services through CESLIN in 2 areas. One is insurance matches, as well as financial institution data matches, or FIDM. I told y'all we love acronyms. So on the next slide, we'll take a look at some data on those matches.
What's an insurance match? What's that mean?
So an insurance match can include things like property and casualty insurance companies matching against workers' compensation claims or bodily injury claims and certain life insurance claims. So if one of our non-custodial parents who has not paid his child support is due a settlement of some type, we can then put a lien so that
If the other person has life insurance and he gets a couple $100,000, then that lien can go against that. Is that right? Is that okay?
right.
All
So the lien,
Got it.
the money that we collect from that lien can pay towards the child support that is owed, whatever back child support is owed.
So you have a non-custodial parent, maybe was in a car accident, gets a insurance reward. If you have the ability to garnish it, essentially,
Right.
get a lien attached to it, have it paid over to you.
That's correct.
Great.
Yep. So we get their help in getting a lot of matches. We find out about some insurance settlements, mostly from the custodial parent. If they learn about it, they tell us, but there's a lot we don't hear about from either parent. And so this service helps us to get more matches than we could get on our own.
Can it be a lien on real estate ownership?
So we can do liens on property. But again, we have to be able to know that they have the property. So sometimes we are able to find that on our own. And a little bit later, I'll get into some information about this CESLIN process and what they offer in terms of real property.
Only issue on property lien is if they're not going to sell it.
Mhm.
Done to
You
you.
can't get you.
Right.
I mean,
Yeah, that's right.
the plumber might not get his money 10 years until I sell the place.
But when they do sell it, that's
Yeah,
that's
that's
a
right.
great payment for
That's
that family.
absolutely-
It just takes a while
Yeah,
sometimes, for sure.
That's good.
Yeah. So I just wanted to provide some data on our current matches. So as of the end of February, as you can see, we've had 2,185 matches so far this federal fiscal year. Last year, by the end of the full year, we had 4,269. And at the bottom of the slide, you can see the number of cases we have that have not yet paid towards arrears that are owed is over 83,000. So that's really a group of cases that could benefit from, you know, having any matches that hit here. So
But now how you,
Yeah.
if I've got insurance, if I've got an insurance company and I've sold all these policies and stuff like that, so how do you get to that information? Is it through the state insurance commission?
So, so we work with Seslin. We send Seslin a file of the cases that we have where a non-custodial parent has
Okay.
arrears owed.
Okay,
And then they match with those casualty insurance companies, property and casualty
Okay.
insurance companies for us. And if there's a match in common where they have a claim for someone that we have on our delinquent file,
cool.
then they let us know that. And not every match is going to result in a collection. You know, it could be that by the time we learn about the match, they've actually paid off their arrears. There could be other factors that happen.
Now this is cases, not dollars, right?
Correct. But
So
I
you
have dollars
dollar
on the
numbers?
next slide.
Oh,
Yeah,
there you
I
go.
do.
There you go. All right.
So, yeah, we can just jump forward to the next slide with collections. So as you can see, as of the end of February, we had approximately $3.6 million that had been collected as a result of those matches so far this
Cool.
year. And for the entire year in federal fiscal year 24, we had over 9 million that came in through this
Yeah.
process. I actually just got an update after this slide was submitted. So we're up to $4.5 million in collections as of the end of March through this settlement
Wow.
process. So it's a really effective process. And so that leads me into my next slide of a couple additional services we're looking to add.
Where does that money go?
To the families.
Okay,
So to the families that are owed the support.
so it's not reimbursing the state for
No.
monies that are laid out. It goes to the families.
That's correct. We have a very small percentage of cases that were opened because a parent was receiving TANF.
Yeah.
And so there are a very small, like 3% or less
Mhm.
cases that may have an arrears balance that's owed to the state. But it's a very small number of cases.
So how long does it take from the time you get the money to get it in the hands of the family?
Once we receive a payment, we're federally required to disperse that payment out to the family within 2 business days. So it's a quick
And
turnaround.
is that treated as income for them?
Income as far as
Taxable income?
Mhm.
that, I do not know. I will have to check on.
I just,
I know there are certain things that parents do have to report their child support income.
Yeah.
And
if it's insurance policy, it probably don't, you know, it's treated as income. It might not be income because it's really a debt owed.
Yeah.
Anyway, that might be something.
I want to say that there is a section on taxes that you do have to report child
Yeah.
support
Yeah, they usually get their money.
collections received. But yeah, I'll check on that. So we are looking to add some additional Seslin services, and the governor's state fiscal year 2026 recommendations included just under $61,000, which would allow us to implement real property and lump sum matching services through Seslin. So again, we do currently place liens on property. And we also received some information about employers who are due lump sum payments from their, employees who are due lump sum payments from their employers that we can potentially collect for their child support case. But Seslin just offers a much more robust matching service that we can take advantage of. So with those 2 processes, once we're able to implement them, they would result in approximately $2.7 million in additional collections each year for families. So we're really excited. We know the latest or final version of the budget did still include this enhanced funding for this process. So provided the governor's signature is on it, then we will be able to move forward with adding these 2 services in the contract. So we're excited about that. And then just really briefly, I wanted to provide y'all with just a quick update on our our overall federal fiscal year 25 performance, we are currently ahead of our 2024 performance in current support, arrears, paternity, and support orders as of the end of March. So all four of those key areas. And I also just received an update this morning that we've received over $5 million in payments through our mobile app in March, which was the first time in a couple years we've been back over the $5 million mark. So I just wanted to share that brief update with y'all. And again, thank y'all so much for your time today.
Thank you.
Thank you so much.
Very good stuff.
Thank you.
All right. I guess we can, do y'all feel like we need a break or can we keep going?
We don't have a lot of business to.
Well, I
to
think
do,
we've
do
got the
we?
minutes,
No.
so I'll go and call the meeting to order then. Right, and first order of business, I guess, is the minutes approval. The January 8th meeting minutes been distributed to you. Are there any corrections? And is there a motion?
I make a motion to accept the minutes as written.
All right, second, okay. It's been moved and properly seconded. The Board of Human Services minutes for January 8th meeting have been approved. And now we'll just take a vote. All those approved?
Aye.
Aye. Aye. All right, no opposed. So with that, our next meeting is on July 9th, but I wanna, just a couple of you guys, I mean, obviously Jack and Wes have been working on the committee for aging. And, Scott, you've been on you're head of that committee for the children's. Any big things either one of you guys want to share, or y'all on the phone as well?
I'll say I learned more about the foster care and than I have in this 3-4 months we've been doing it this year.
Right.
That I probably learned in the first decade.
6 years, yeah.
So they're very productive. I
Good.
think they're,
All right,
it's good for the folks that you probably feel the same way. But,
Jack, you you or Wes on the aging? And Monica, I'm sorry.
Yeah, and I said my piece, Monica. If you have any,
Well,
it's been great.
yes, it really has. When you first came up with it, I said, oh, my God, are we
One
gonna be able
more
to
meeting.
do that? And it has been great. I'm thankful that Wes is chair and Jack has offered so much.
Right.
I do think we need to take some of the things that we've learned and contact our legislators.
Yeah.
Yes,
Because
that's the legislative process is part of what we need to do
yes,
to move the ball forward in each of those categories.
I've learned a lot from Lisa, who has one of the subcommittee members,
Right.
because she's a foster parent.
Yes,
yeah, she
and
knows
so-
firsthand.
So thank you for that, Lisa.
yeah, and Doug Aldridge
Online.
has gone through the adoption process.
Yeah.
And so Doug, thanks for y'all's help too on that.
Yeah.
You're
welcome. Thank you.
Yes, and so
And
one of the other things generically before we disperse here is that I just want to say that the board is desires to be more active and to be more specific about how we help. And so everybody's heart's there. And so for all the different areas of the Department of Human Services, our desire is not to cause problems, but it is to help with some reality and to force so that the different areas of what the great work all of y'all do can be experienced by more people, So anyway, and then I would say this in one of the things that we're going to try to make happen, and yes, Candace is not here to give a report. I'm sorry. Oh, the next, okay. All right. And so we'll see her later. But anyway, one of the things that everybody is consistent with has a desire for is to have more training with our group in orientation, I might call it. We used to when we would become a board member, we would go through orientation. And it looked something like it was, 2 or 3 hours before the normal meeting, we would have the different areas where we got to really jump in and ask into the weeds, if you will. And so that's something that we're gonna want to try to make happen. And it's sort of happening a little bit with the different subcommittees, if you will, but we want to be sure we get an overall orientation for really all of us that have been through it years ago, but also for the new folks that have come on board. We want to do that. So that needs to be part of next month's or next quarter's agenda. All right. So with that, I know there's some other meetings that are going to go on after this.